annually, transplant needs to perform a transplant is going to ask you to perform a procedure called a coronary catheterization, or a coronary angiogram, or a coronary angiography. What that procedure is when they inject you with a dye in order to take pictures of your heart. Transplant has to be sure that you don't have any heart problems or heart conditions, and that your heart is strong, all the valves work properly, there's no blockages or anything like that, before they can clear you for transplant. So for me right now, I need to confirm that I have a primary. There's two things that transplant need from me. I need to confirm that I have a primary care doctor. So since I moved, I haven't really established that, but now I have, and I needed to get this coronary angiography done. Now, coronary angiography isn't a procedure that's, it's not like major surgery, but they do use a localized anesthetic on you to put you under kind of like a twilight sleep, while they either use your wrist or they go through your groin. I was that they would not use my groin to do this procedure, and they were going to, but then at the last minute they changed it because, a lot of the veins and arteries in my arm were fine for it. So what they do is they make an incision, and then they pump dye into your into an artery, into the vein, into the artery, which goes into your heart, which illuminates it, so that way they can look and take pictures, make sure that everything is working properly, as I've stated before. So afterwards, yes, my wrist was sore. It took about 3 to 4 days for the pain to subside, but there still is a little bit of pain on the site of the incision where they put the dye in. So maybe 2 more days, and then my wrist will be fine. There's still a little bit of swelling, but it's not too major. So immediately after the procedure, there's certain things that you can't do, right? So you can't drive for 2 days. You can't lift anything over a certain amount, because your wrist has been compromised. That means you gotta take it easy. Also, the procedure involves heavy body shaving in the groin area and the wrist area. And let me tell you, this dude that was shaving my groin for this procedure had the heaviest hands I have ever experienced from a nurse. It was like the guy was digging for gold in my crotch to get ready for this procedure. So as I've stated, they use like a localized anesthesia. They numb up the area via syringe. Then before the procedure starts, they give you a Benadryl and I believe a Valium. Then they hit you with the anesthesia, and I was on the table, and then the next minute I was back in post-op recovering. Afterwards, they incentivize you to drink a fair amount of water, so that way you can get the anesthesia out of your system, the dye can pass out of your body, and then that's it, and the procedure's over. It's not very invasive, but it's invasive enough. So in closing, being on the transplant list is not it's not without things to do. Transplant are going to ask you to do a litany of different things in order to clear you for transplant. None of this stuff is a cakewalk. None of it. None of this stuff is easy. It's not just, oh, they just put you on the list and then you just wait, and then you just wait patiently and quietly, and then they just give you a transplant. It's not like that. Like, you have to be able to maintain your health and hope that nothing happens to you, and hope that your health doesn't decline for possibly years at a time. And sometimes maintaining health is not always up to you. I've said this before, that dialysis is not designed for long-term use. Dialysis is not designed for people to use. It's just designed to keep you alive. And the longer you're on dialysis, the more it's going to, I don't want to say damage, but the longer you're on dialysis, the more it's going to affect your health. And that's just a fact. That's just what dialysis does. It's not some miracle treatment. That's not what it is. But you're going to have people people within this profession that are going to try to make it seem like dialysis is just this miracle thing, and that it's a privilege and it's an honor for you to do it, and there's no side effects. There are side effects. There's long-term side effects that come along with being a dialysis patient for long periods of time. And heart weakness is one of them. So annually, you have to, per transplant's recommendation, you have to get your heart checked. So that way they know that they're not giving a transplant to essentially a dead person walking.